Hey, it's your friend Mel. This one's the big one on women's health. We're talking hormones, menopause, birth control, UTIs, and sex with Dr. Rachel Rubin, an acclaimed urologist and sexual medicine expert, because you deserve care, clear answers, and zero gaslighting. Please listen and share this with every woman you love.
I'm thrilled to be here. My mission is simple. When women understand their bodies across puberty, pregnancy, perimenopause, and menopause, they advocate better and live their best lives.
What's a sexual medicine doctor versus a urologist?
Urologists treat kidneys, bladders, and genitals for all genders, and sexual medicine is part of that. Gynecology focuses on reproduction and cancer, but most doctors were never taught women's sexual health, which is why so many of you hear dismissive advice and feel ignored.
What symptoms should we stop normalizing?
Frequent trips to the bathroom, dryness, painful sex, harder to reach orgasm, and low desire that bothers you. These have biology behind them and real treatments, including FDA-approved options for libido. Don't settle for endless leakage or recurring UTIs without a plan.
Give us Hormones 101 across life stages.
Ovaries make estrogen, progesterone, and testosterone. They rise and fall through the cycle, spike in pregnancy, then crash after delivery, which is why breastfeeding often feels like temporary menopause. Testosterone declines with age and can be lowered further by pills like combined birth control or spironolactone, which can drive low desire, pain with sex, and UTIs. Perimenopause is chaotic swings, and menopause is an abrupt shutoff.
What's a big myth that needs to go?
That UTIs are only an antibiotic problem. Hormone shifts remodel the vaginal and bladder environment, a cluster we call genitourinary syndrome of menopause, even though it also shows up with birth control, breastfeeding, and cancer endocrine therapy. Microdose vaginal hormones restore the microbiome and prevent UTIs dramatically, and the American Urological Association issued guidelines on this in 2025.
You're saying hormone changes at any age can raise UTI risk, and local vaginal hormones are a safe, effective prevention.
Exactly. We've known this since the 90s, but scary box warnings and stigma kept doctors from prescribing. Grassroots work helped remove those warnings, and the data show these tiny doses are safe, even for very old or medically complex patients.
Help us picture GSM and why pH matters.
Without estrogen and testosterone, tissue thins, pH rises, bad bacteria flourish, and sex can hurt. With microdose vaginal hormones, acidity returns, natural lubrication comes back, urgency and leakage calm down, and UTIs drop. Think of it as watering a parched plant.
I had chronic UTIs in my 20s, 2 kidney scares. Then years of dryness and urgency after kids. I white-knuckled it with antibiotics, cranberry, and ointments.
You are underserved, and I'm sorry, local vaginal hormones belong in your toolkit, whether or not you're on systemic HRT.